Dr. Megan, your prednisone pharmacist here. And if you've ever wondered, and what I'm feeling real? Am I the only person who's ever felt this way? Well, we finally have a book published telling the true story of how terrible prednisone side effects really can be. From the insomnia, the insufferable insomnia, to even being admitted into a mental health facility. Oh my goodness. Luckily, today we have the chance for me to interview D.P John, the author of Steroids Stole My Summer.
Hi, Dr. Megan. Thank you so much for having me on your show. Appreciate it.
So excited to have you here. So DP, what is Steroids Stole My Summer all about?
So, Megan, this is a true life story about a man in his 40s that was overprescribed for a simple inner ear infection. And he was overprescribed with steroids, which kept him sleepless for over 3 weeks until a manic event that got him committed to a behavioral center. And that's where he got stuck for 17 days. And his diagnosis from the doctors there was corticosteroid-induced mania. And in effect, the steroids caused a temporary period of extreme high energy or a mood that might look similar to a bipolar disorder.
Wow, that sounds terrible. And what if people hadn't known he was on that medication? Like, just thinking, would they have even diagnosed him with that kind of a diagnosis or not? Like, oh my gosh. So I want to know, what type of steroids were these?
Yeah, that's a great question. So this is a little timeline that I put together about Ryan's adventure here with steroids, really showing the prescribed medicines from, early July until late July. And really what you can see here is really the number of medicines that's kind of shocking and a little bit scary. But as far as the steroids, first he was prescribed methylprednisolone. And then after that, he was prescribed prednisone and then dexamethasone. So in addition to that, as you can see, there were also a number of different types of steroids, including some topical and nasal steroids that were prescribed.
Oh my goodness. Like, why would somebody need so much steroids and all these different ones? It's like he had, like, why wasn't the first one good enough? Why did they have to switch it to another one? Oh my heavens. And he had not just the oral steroids, but he had the topical ones in his nose. That is surprising for just a simple ear problem. I'm really shocked to see so much steroid usage in this situation, because you would think it would just be like a 1 week thing. And somehow he's been given prednisone and dexamethasone and methylprednisolone and these topicals. And they're all steroids, but steroid is like a really big umbrella term. And steroid could also include anabolic steroids, like bodybuilders use to build up muscles and, get that gym body. But that is not at all what this does. Not even close. In fact, these kind of steroids actually make your muscles go smaller. So these are called corticosteroids, prednisone, dexamethasone, and they help us deal with stress. And so this kind of stress he was dealing with, sounds like he almost got way more stress because of it, right?
Yeah, absolutely. The really what was prescribed here, again, for an inner ear infection, at one point after the first steroid was prescribed, he actually felt about 90% better. But then once that prescription ended, really it tailed off. And unfortunately, really what was at the root of the problem with this ear infection was not completely cleared up. So that's where they kind of went back for additional prednisone, and in addition to that, after that didn't resolve the problem, then there was some additional anti-inflammatory cocktails and other steroids and Valium prescribed to actually deal with some of the stress and the anxiety that was happening. You'll notice that that was actually not filled because Ryan at that point got concerned with the overprescription that the doctors were doing. But then he headed back to his general practitioner, who then, yet again, even knowing the situation, prescribed him with dexamethasone, right? They chose a different steroid. And, some other, like the transdermal scopolamine, patch to actually help with, some of the original symptoms that he had, which was simply around feeling dizzy and uneasy on his feet, right? So the reason why this story is so relevant today is really due to the numerous uses of prednisone that we see out in our environment. You talk about this every week, Megan. And then now we have the added use of dexamethasone for the sickest COVID patients for COVID-19, especially with these COVID-19 variants. We could be seeing an increase in the patients who have certain mood changes and manic events, like Ryan in my book, or even psychosis. And really the effect could be yet another massive influx of patients needing mental care, yet again, overwhelming another healthcare system as it has done time after time over the last year and a half. So really my feeling is that we need to get ahead of this. We need to start thinking about how we can address the side effects now.
That is for sure, because there are so many terrible side effects. I mean, and what we're seeing here with this, what you're showing on this timeline is we're having a prescription for a prescription for a prescription, right? Like there was one initial prescription and then all of these other prescriptions are to treat the side effect.
So true.
Oh, and that's just so disheartening when there should be a better way, right? And so you mentioned some things that could be done to address this problem.
Yes, absolutely. So really the first thing is around drug monitoring, right? It's really not present in most medical practices today. And it's really key to understanding more about the side effects of these corticosteroids and to reducing the disastrous effects to a patient and their families, as Ryan had suffered, whether this is a simple mood change, mania, or even psychosis, right? But drug monitoring is really just one aspect of the post-discharge care that is a necessity to both reduce the recovery time and reduce healthcare costs. However, it's often only self-service today, right? You get kicked to the curb sometimes and say, hey, call us if you're having an issue, right? Well, that's not drug monitoring. It's definitely not professional drug monitoring. No. And, these post-discharge care includes medications, wound care, physical therapy, mental counseling and therapy, right? And even post-discharge visit coordination. Think about the mental counseling that people have from all the anxiety and different mood changes. You need some way to treat that. So this really is an area that I feel that the healthcare community should be rallying around to create better methodology and processes and tools. Not only would this help their business models, but it'd also be important that we improve the lives of the public, helping them to get back to normal faster and consuming less of their hard-earned money. This slide here shows the recovery timelines and costs that were associated with Ryan. And as you put your eyes on this, you're going to be sad, because if you look on the left-hand side, this is the actual path and treatment that was taken. 47 days, $26,000 just in healthcare costs alone, not to mention the loss of Ryan's wages that he needs, that he needed for his family. July 1st through August 16th. So, roughly, 6-7 weeks, led him from the steroid, again, all prescribed steroid use, multiple emergency room visits, doctor's visits, insomnia building, and that's really what led to a manic episode, and not only just cost of money, but also the cost of humility, right? In the town where Ryan lives. A visit to the crisis center that was unfortunate, that could have been stopped, maybe just checked into a hospital and be able to give him better sleep aids and things. And then certainly ending up in a behavior center for 17 days at a cost really to healthcare and to Ryan, for $18,000. And I'm not talking just, hey, check in and check out when you want to. I'm talking he had to stay there until he was released by his doctor. So better cost of the scenario is, certainly still using the steroids because they were important to his recovery, but actually, having drug monitoring to detect those side effects and prevent this type of manic episode, getting a prescription simply from the, information provided from the drug monitoring to get a more effective sleep aid, right? And at home, correcting his sleep cycle, no visit to the crisis center, behave center, just staying home with his family and correcting this. Certainly a lot less time, and maybe only $550, right?
That is amazing. The differential between those two. And I was stunned in the book to hear how he advocated for himself. And even with his level of savvy with saying, no, I can't sleep when there's a light on in my room, how that and he helped work with the nurses to find ways to get the light so that it wasn't shining in his eyes all night long, to make it quieter, to like all of these simple changes, how much effort it took him, and that he actually even bothered to try. For most people, they don't have that much savvy in knowing how to change an organization, how to make these huge yet simple changes. And so it sounds like this idea that you have, it comes with a lot of processes, a lot of technology, a lot of people who need to be trained. And how can we do, what can we do now before all of that process is in place? What can be done? What can be done in the meantime?
Megan, I so much appreciate you bringing up that reference because, even though I wrote it and Ryan lived it, every time I think about the opportunities that Ryan had to actually help to try to improve the system while he was stuck in there for 17 days, and, not only helping himself, but helping other people, just to get that ever so necessary sleep that is so critical to, rebuilding the mind, rebuilding the body. So important. And you're right, there are, long-term things that we can do with processes and methodology and people and money. But there are a lot more simple things that we can do. As an example, doctors' offices, healthcare institutions could simply start off by following up with their patients via phone or text or a simple internet survey that would at least alert the doctor's office if there was a concerning side effect, that needed to be followed up on with patients that are more at risk, right? They're going to have to use, their intelligence to determine, hey, which are the risky patients, which are the risky side effects, but they know that. So if they simply, pick up the phone, or put something simple in place. And then once, there's more momentum around this, right? Once companies, build these more post-discharge tracking systems, they could put them in, and this would really further automate it and scale things to cover more institutions and different types of post-discharge care, not only, relating from medications and drugs.
Yeah, I think this is awesome. It would just, it just hurt me when I was reading this, your beautiful book, to hear how the healthcare system was failing him, to hear how in this place where he's supposed to be recovering from a mental illness, that they're shining a flashlight in his eyeball every 30 minutes through the night. Like, just knowing the pharmacology of prednisone, the mechanism of how we sleep, how both those things are completely interfered with by light, and how just we absolutely need melatonin to be released, and how that's completely impossible when you have a flashlight in your eyeball every 30 minutes. No wonder he couldn't recover.
Absolutely.
I just floored. Like, it just so sad. There's just so much room for improvement. Oh my goodness. This book, if you are taking prednisone, this book is just like, oh, I understand you. And you can finally have somebody who's like, that is exactly how I felt too. So based on all of this that you have shared, I want to know, what is your best advice for prednisone warriors?
Oh, great question. So, keeping things simple, I'll give you 3 things that I would suggest. Number 1, first, to everyone, write down all of your medications, right? Keep a medication notebook. Take it to your doctor's visits regularly, right? Because they're not tracking your medications, especially as you go from different doctors' offices that have different back-end technology systems, right? They're not sharing that information. So you're going to have to share it with them directly and keep asking, hey, did you see I'm taking this? Are you aware of this? Secondly, use the rule of 3, which I write about in my book. You and 2 family members or friends tracking your behavior and well-being from the medication, right? You'll have your opinion of how it's going for you. And, if you're in this state that Ryan was, it might be a little bit off. And then you'll have the opinions of your friends or family members. And, these are important to share together so that you can understand, what is happening or what's not happening, and then seek additional help from your medical providers. Thirdly, and even most important to this, I would say uprising of drug monitoring and post-discharge care, which is keep asking your doctors if they offer it, right? Hey, do you offer drug monitoring? Do you offer post-discharge monitoring? Is it free? Is there a fee for it? Can I get involved in your program? Because if you keep asking for these services, then demand will drive the healthcare industry to change. And there's some institutions that are already doing this already. However, they're few and far between. So we have to keep asking and demanding these types of services.
Oh, I couldn't agree more. It's amazing how some people when I would dispense these medications to patients, how some of them are like, when we offer, hey, do you have any questions? They're like, no. And it's like, this is your chance, guys. This is your chance to say, I don't actually have a question, but what should I know about this medication? Just giving every healthcare provider in your team, whether it's your doctor, your pharmacist, nurse, whoever, the chance to really give you what advice they do have. Because if you're like, I don't have any questions, then you just really miss a huge chance, because what your doctor or pharmacist or whomever should be telling you about your steroid prescription is probably not what you think. And you might be surprised. It's funny, my pediatrician always apologizes when he's talking to me about my children's immunizations. And he's like, oh, you probably already know this because, you're an immunizer. And it's true. I did already know that at one point, but I don't live it and breathe it every day. And so I always say, I want to hear it. Tell me again, because I want to be sure that it's top of mind for me, and that when I'm in his office, that I'm using his expertise to the highest level, that I am demanding his full attention for me and my baby. And so when you are in a healthcare setting like Ryan, that you say, you know, I can't sleep. That
Absolutely.
whatever weird thing you're feeling, that you communicate that with your doctor, because they can't know unless you tell them. And they can't know that you need help. They can't help you without your part in the healthcare triangle. And so you need to demand that drug monitoring by being in such close communication with your doctor. People are that come to me all the time saying, you know, I have this terrible anxiety after my doctor gave me either dexamethasone or prednisone or the Medrol dose pack, the methylprednisolone, and they just feel totally disabled, and they say I can't sleep and I'm fidgety and jittery. And I said, have you told your doctor? And they're like, no. And so you need to be your own best advocate, because they can't help you with this anxiety, with this jitteriness, with the lack of sleep, unless you tell them. And if you saw that cool chart he made, it's got like what should have happened. And what should have happened was appropriate care from that first doctor. And the only way that first doctor can give appropriate care is with appropriate information from you, sharing your experience. They need to know. So I couldn't agree more with your suggestions here, that you demand this post-discharge drug monitoring. And then I've got to ask, so DP, we've heard just a snippet of this story. Like, guys, I listened to this book and it is fascinating. Like, I couldn't believe it. So I just want to know, where can we find you, DP? Tell us how to get a hold of this book so that we can hear his story and how to find these solutions that you proposed.
Absolutely. Thanks, Megan. And, you know, you brought up such great points about, you know, advocacy, because I, as a writer, and, you know, Ryan as the subject, you know, we both believe in science, right? We both believe in medicine and, you know, healthcare, you know, everything about that. But it's important to be your own advocate, because, you know, people are people, right? We all make mistakes, and you really need to take your body and your own health so seriously, and you have to take charge of it. And, you know, regarding the book, I would say, I hope that whoever reads this or listens to this book really spends some time to, you know, understand what's happening, to laugh at the funny things, right? I specifically wrote this, right, with the direction of Ryan to be funny, because there were some funny things that happened, right? And there were some interesting things that happened, like you mentioned about, you know, the quest for sleep and the quest for, you know, getting dim areas and darkness so that people can sleep and recover. So there's some things that hopefully, you know, the readers will, you know, take away from this and apply to their own lives, and again, get some amusement out of it, as I do every time I think about it. So you can find the book on Amazon, Kindle, iTunes, Barnes and Noble. It's on a lot of the smaller vendors as well. And you can also listen to the audio version on Audible. And really enjoyed being here today. Appreciate everything you're doing, Dr. Megan, to, you know, put light on these subjects, and all you're doing to help your constituency base. So thank you so much for taking the time with me.
Oh, it has been our privilege to have you here, DP. It's so nice that somebody, you, took the time to actually write this story down, because the saddest part about these steroids is they're old drugs and nobody is paying attention. There's no big drug manufacturer out there who has this big wide wallet willing to spend lots of time to help people truly understand what it feels like. And so it's such a privilege that we have this book now, that you can read it, you can find out what someone else's experience was, so you can realize that you're not the only one. And not only that, so that you can find out that it's the drug, it's not you, that his story truly illustrates that prednisone can make you feel completely insane, completely not yourself. It can make you do things that you are not in control of. And so this book really lends legitimacy to all of those who are suffering so much, thinking, I think I've just gone insane, and that it's not. You aren't insane. It's just this drug. There is help available. And so many of these principles and ideas are found in this book. So I encourage you to buy it either on like the Amazon or the Audible. I personally love Audible. I love audiobooks. I'm a mom. I can't just sit there and read a hard copy of a book. So the only way I get it done is by listening while I'm doing the dishes or laundry or whatever. So I would highly encourage you to get this book and start acting on what he suggests at the end of the book. I'm signing off as Dr. Megan, your prednisone pharmacist.